that is that the sunset is going to be influencing those omega-3 fatty acids are definitely working on the inflammation in your body. They're definitely, and there's good data out there. Once Dan forwarded your email to me, and I started doing some reading, and there are dozens of studies out there showing that these omega-3 fatty acids have direct effects on the heart cells. And there are three mechanisms by which those omega-3 fatty acids can influence heart rate. And one is by the direct effect on the wiring, if you will, in the heart. And in my reading, it seems to me that is the number one benefit. It's actually through direct effects on the wiring. And then the second one is by allowing the left ventricle of the heart, which is the major heart pump, to relax more fully in between the heartbeats. And so with that increased relaxation, you get increased filling, and then the heart is able to empty and pump out more blood into the rest of the body. So that relaxation is another mechanism. And then the third one is through the effects of inflammation on the body and decreasing your overall levels of stress hormones. So those are three immediate benefits from the omega-3s in the sunset. And then with the NitroFX, you have the effect of the nitric oxide on the endothelium and relaxation in the whole arterial tree, which allows the blood vessels to open up more fully and that dynamic left ventricle to pump your blood all the way through the vessels and get the oxygen and nitric oxide exactly where it belongs to the whole body.
Now, what we're talking about here, Claire, is we're not wanting to make product claims. So we're saying that in the scientific literature that I know you studied for the last 4 weeks, because I know you've pulled several hundred articles, you're seeing that these individual ingredients that are combined together to make these compounded products, these individual ingredients are very well documented in the literature. Is that what you're saying?
That is what I'm saying, Dan. I think I told you there's a book by Dr. Barry Sears, and he wrote it a couple of years ago. I think it was 2002 or 2003. But he summarized in this book, and it's called the Omega RX Zone. And he summarized at that point all of the literature that's out there on the effects of omega-3 fatty acids on health. And I've been sort of perusing that along with a number of other databases that are available to me through the hospital. And I am so impressed with the amount of information that's out there supporting the benefits that these omega-3 fatty acids have on our health and well-being. And I know it's very important for us to remember that we cannot make claims. The FDA will not allow us to make claims for specific products that are marketed by Kyani, but we can certainly say that there's good literature out there that these individual ingredients can have, a certain benefit, and the science supports it.
Well, let me turn back. Walt, are you still with us?
I'm here.
Well, what I would like to do is just say thank you very much, and I'd like your permission, Walt, for us to post, and I know that I've asked you to rewrite this in a way that would be a little cleaner. Would you be willing to provide to us in writing your testimonial with the dates, the heart rates, the blood pressure readings, so we can post it on the company's blog?
Absolutely, and I will do that on Friday and get it to you no later than Saturday. And I understand what you're saying about making claims, but you know what? When it happened to me, I can say whatever I want.
That's very true. Well, I know you've got to go lead a Bible study, so have a wonderful evening, sir.
Thanks a lot, and thanks for your time and all your leadership.
You betcha. Well, Claire, let me come back to you here. We spent a lot more time on this, and we had some questions that came in from last week's call, and I'd like to jump in the middle of these just very, very quickly. Not to say that I think that what we spent our time on wasn't as valuable, because I think what we just did was very, very valuable. In fact, I'm going to suggest that for those people that have had a just crazy result like Walt did, that they send a copy of it to me in written form, allow you to review it, and then invite them on a call to discuss, just like we did with Walt. Is that something that you'd be open to?
Absolutely.
Okay. Well, Claire, let me jump in another one, because we had question after question after question come in with regards to diabetes. And I think that there's a misnomer about diabetes, what causes people to die. And as an internist, you have a vast knowledge of diabetes. So I'll ask you a very closed-in question. When a person has diabetes, do people predominantly die from an insulin overdose, insulin shock, or from the opposite, their blood sugar going too high, or do people predominantly die from the damage that diabetes does through cardiovascular disease?
I would have to say it's the damage through the cardiovascular disease. The
and what percentage
level
would you attribute?
I'm sorry?
What percentage would you attribute to low blood sugar, high blood sugar, as far as a person passing out and dying, or the cardiovascular disease process from diabetes?
I think it has to be 90%, the cardiovascular disease and inflammation. It's really, when we see a patient with diabetes, and I had 2 newly diagnosed patients with diabetes today, and so this is really on my mind. And the thing that we immediately jump to is the cardiovascular risk factors, and getting them on medication that's going to minimize their cardiovascular risk.
Now, in the clinical setting where you're at,
blood sugar. Sorry?
Now, in the clinical setting you're in, you are an employee of a major metropolitan hospital.
Yes.
So you are held to following standard medical protocol. You're not allowed to use these types of products we're talking about tonight in your medical practice. Is that true?
That's true.
But you're precluded from that. How frustrating is that?
Very frustrating.
I feel for you. I really do. I hear that from doctors all the time. It's like, geez, Wendell, I wish I owned my own practice.
Yeah.
Let me jump out one more thing, and we're going to close out, and I've got to bring in our CEO. Claire, if you were to, in a nutshell, say that this one product of Kyani's, the Sunrise, our functional antioxidant beverage, or our Sunset, which is our proprietary omega-3 with tocotrienol form of vitamin E, or our Nitro FX, which is a tincture that causes nitric oxide generation right through the mucosal tissue of the mouth without having to go through the stomach and the GI tract. If you were to say that one of them was the best one, or would you say that they were developed as, well, Kyani calls them a triangle of health? Well, what's your opinion on that?
Well, honestly, Dan, I wouldn't want to have to pick one, because the 3 of them together really function synergistically.
Okay.
And like, if I had to pick one, if you said to me, Claire, you can only take one of these products, I would be very, very uncomfortable. I wouldn't know which one to pick. I want all 3 of them in my life, because I believe that to optimize my own health, the best opportunity that I have to do that is to be taking all 3 of them. The ORAC value of the Sunrise is tremendous, and I know that that is reducing the free radical damage in my body. The Sunset, as we've talked about, has tremendous anti-inflammatory effects and benefits in terms of the brain, the heart, metabolism in many different ways. And we can talk about each of those organ systems in great depth. And then Nitro FX has all the benefits that we know about nitric oxide. So I would really feel very uncomfortable if you made me pick one.
So truthfully, would you put your reputation on the line and say that you really would need all 3?
I would. I'm here to do it.
Are you being paid for an endorsement
I am not.
in any way?
No, I'm not.
So you
No, I'm
absolutely
not.
are saying
I am
that
a
this is what you
Kyanie
believe.
distributor. Huh?
Okay, so you're doing this, and you are a Kyanie distributor, but the only reason you're doing this call is because you believe in what you're saying.
100%.
And you're not a paid consultant.
I am not.